Good morning, everyone. It is April 22nd, 2025. We will call the Board of Health meeting to order. Present, we have Board of Health members Joan McNeil, Norman Weinberger, Anthony Santella, Ken Lalim, and Janet Karpiak. Good morning, everybody. We also have staff members David Reed, Aniela Fignon, Brian Weeks, Teresa Argandesi, and myself, Deanna Diamore. Our first item on the agenda, or the next item, is the approval of the March 25th, 2025 meeting minutes. Do I have a motion to accept the minutes? Anthony first. Do I have a second?
Second.
I think I saw Joan's hand first. Thank you, everybody. Second. Any discussion? Any edits related to the minutes? All those in favor of approval, say aye or raise your hand.
Aye.
Any opposed? Any abstentions? Right, I think all motion passes unanimously. Thank you, everybody. Next item is public participation. If there's anyone from the public who would like to speak, please digitally raise your hand and we will let you speak. Just as a reminder, 3 minutes, and it pertains to an item on the agenda. And I believe we have Diane Lauricello who would like to speak. Good morning, Diane. Danielle, are you able to? Okay, great. Diane, if you can unmute yourself. Good morning.
Good morning. Can you hear me, Deanna Diamore?
Yes, I can hear you.
Yeah, there was a little gap there for unmuting. Good morning, Board of Health and staff. My name is Diane Lauricella, 21 Little Fox Lane in Norwalk. I'm an over 40-year member of this fine community and have spent the majority of my time as a responsible resident to, on occasion, bring forth information as well as ideas and solutions relating to environmental health, not only of the environment, the critters and the waters of the state, but also the public, the people, human environmental health. And on this day, which is Earth Day, April 22nd, I wasn't going to speak, but I wanted to challenge this board of responsible and impressive people, well-meaning people, to, in light of what is going on in Washington, where the EPA, the NIH, many of the reason I'm speaking is to the epidemiological report as well as the director's report on the agenda. I just wanted to say that because of what is going on in Washington so far, it'll take a while for the lawsuits to play out. Now more than ever, the role of a local health department such as ours is very important. And I challenge all of you to be bolder and to seek more answers and not just wait for someone from Hartford to let you know that an environmental issue is something that's on their radar. Because we here in Norwalk have some environmental concerns that are not being addressed with the boldness and creativity. And so I'll bring up one thing that I feel behooves this board to get involved in at this moment. And that is the issue of artificial turf fields, playing fields. Norwalk has had 7. We removed one for the Norwalk High School. There is wide-ranging, accepted, peer-reviewed science on the multiple dangers of artificial turf fields. And currently, as we speak, there are 3 new ones proposed to be used at the Broad River Baseball Complex. I am a proponent of natural turf fields that are funded properly, designed properly for drainage, so that our children will not be the bearers of our bad decision-making and expediency as far as maintenance of playing fields. I played on natural turf as a child in Newtown, in field hockey and baseball. In Norwalk, we're now proposing we'll have 10 artificial turf fields. And I believe it behooves this board and the epidemiologists and Deanna Diamore to get involved in the issue of a health study where peer review neutral party is asked to look at the pros and cons of artificial turf fields. The mayor
Ms.
has refused to
Varicella,
do so.
I
Yep.
thank you for your comments.
This has
if
to do
you're,
with epidemiology. And no one is looking at it. So I ask that this board take a look and get involved. Thank you.
thank you, Ms. Varicella. I don't think there's anybody else from the public who wishes to speak, so we will close public participation. And next we have our epidemiology updates. So Brian, I'll pass it on to you.
Okay, hey, good morning, everybody. Hello, board. Hello, Deanna. Thank you. All right, so we're going to jump into just kind of the overview for just three things. Just quickly an update on the respiratory illness situation. Secondly, just an update on the measles situation. And then number three, just a quick check-in reminder about ticks. You know, 'tis the season because, you know, the weather's getting better, but also ticks are always going to be out, you know, if you're also interacting in the woods and your pets as well and things of that nature. So anyways, we're going to jump right into it really quick. So let me just do my screen share. So what you're seeing is the usual, the respiratory illnesses data channel. This is looking at it for the nation. So just a quick check-in and where we're at. You know, obviously with the better weather, things are decreasing. So that is very good. So the overall situation for the country is at low. Emergency department visits are very low and decreasing. All three of them are decreasing, but very low for COVID, low for flu and RSV. And then the wastewater viral activity, which is going to be, again, our good indicator if things are going to be picking up again or something to keep an eye out for. COVID and flu at low, RSV very low. So overall, good situation nationwide. Now, if we zoom into the state of Connecticut, more or less the same thing. Low overall respiratory illness activity. It's low for COVID, and low for all in terms of COVID, flu, and RSV for ED visits. Decreasing trends for COVID and flu. No change for RSV, but RSV is also a very low activity in general. So great situation. Wastewater viral activity. We did see, you know, our high COVID levels go from, you know, high to moderate for COVID, but for flu and RSV, we're at very low. So overall, still good that we're seeing the COVID wastewater viral activity drop a little bit, but it's still a little bit higher than especially the nationwide trends. So I just want to be mindful of that. So just kind of jumping over to just other means of monitoring the situation. This is again the NRE VSS dashboard from the CDC. This is showing weekly percent of tests positive for respiratory viruses. So we've covered this before, but you know, we're just kind of looking at the trends for overall the respiratory viruses that they supply here from the CDC. The blue here with the triangles is for flu, and you know that's what we've been dealing with this season. It's definitely been a flu season. It's on again that downtrend that was indicated. This is looking at it for nationwide, but still that uptrend. You know, I reported out last time for rhinoviruses and enteroviruses, still showing that uptrend and kind of offsetting things. Again, that is to be expected. But you know, it's something that's still to be mindful of, that there are respiratory viruses still even circulating with this better weather. And then followed by number three is the human metapneumovirus. It does show up much later in the winter season / springtime. So it is something that we kind of anticipate, but it is something that is on the uptrend a little bit too. So it's something to be mindful of. And then generally all the other viruses are kind of at similar levels. So that's including, you know, SARS-CoV-2, the regular coronaviruses, you know, parainfluenza, RSV, adenoviruses. So it's kind of in that mix. So you have three that are kind of, in terms of that comparison for the weekly percent positive test nationwide, that kind of standing out. But again, you know, that all boils down to the same kind of prevention measures. Fortunately, again, you know, the CDC has kind of developed this infographic and you guys are very well familiar with it. So I'm just going to breeze through it really quickly. But again, immunizations for any of and following the recommendations relative to that for anybody eligible, you know, the respiratory hygiene, the hand hygiene, and then along with getting the cleaner air, which is much more feasible and opening the windows, but then being mindful of allergies now. It's the season for that too. And as you probably have also seen on your cars or on your windows, just a lot of pollen accumulating. So just be mindful all that's in the air too if you also have allergies. But then a MERV 13 filter or better, a HEPA filter is actually what can help with that in the indoor air quality. But that also means, keeping your windows closed because that will obviously mix things up. But yeah, using either or is helpful. Then along with that, seeking treatments if there are antivirals for the like the flu virus or for COVID. So that is helpful too, and we have those available. Just following up with your healthcare provider promptly, and then staying home, preventing the spread. So as your symptoms get better, and then you're fever free without any fever reducing medication for 24 hours, then you can kind of return out in the community. But then taking those precautions for 5 days, which includes those masks, social distancing, and any further testing. And if you're test positive, then again, obviously you're kind of restarting that cycle, just to best protect yourself and others in the community. And so with that said, we're going to switch gears over to measles. We're just kind of looking at the measles outbreak that we're very familiar with. In terms of those numbers, we have over 25 jurisdictions, including, again, New York, New Jersey, New York City, Rhode Island, in that mix, along, unfortunately not Connecticut, but, the odds are just very high in terms of having some sort of exposure scenario where somebody gets exposed relative to the outbreak and they come to Connecticut or they live here, and then vice versa, potentially a case. So it's something you still want to be very aware of. And so with that said, for 2025, we have a total of 800 cases so far. About 69% are generally pediatric. I mean, the way the CDC reports this out is 19 years of age. So 19 years of age younger. And so just be mindful, there's also adult cases that do present relative to this. 96% of those cases so far for 2025 are unvaccinated or their vaccine status is unknown. So again, it emphasizes the importance of getting the vaccine, which is those 2 doses of the MMR vaccine, but then also knowing your vaccine status is important. And if obviously your immune system needs a kind of boost, or especially your higher susceptibility, following up with your healthcare provider to figure out the best measures to address that, which may include getting another dose of the measles vaccine. And so then along with that, you have hospitalizations related to these cases at 11%. So again, not great because that's indicating some severity of illness. And, there are long-term effects that can occur that we're familiar with neurological impacts and other things of that nature, which is important, and even the risk of death, right? And then that's also 3 so far that haven't 2 confirmed so far for the United States and 1 death under investigation. So to that point, you have a lot of other, concerns too, with whoever's going to present with this illness, the majority being pediatric, but, still adults can kind of present with this as well if they're not fully vaccinated relative to measles with the MMR or MMRV vaccines. And so it's just really important. And then also be mindful of other vaccine preventable diseases too. So just making sure you're up to date with all vaccinated vaccines in general. So to that point, for 2024, again, just to give some sort of comparison here, we had a total of 285 measles cases in the country. So when we look at, we're only just in April and it's 800 cases, you can see how big of a deal this is. And how serious of an outbreak this is too, given the geographical spread with 27 jurisdictions in the country, majority being in the South, just because that's where it started with Texas, New Mexico, but how it has spread in the country, just because it has pockets of opportunity, especially with those that are not fully vaccinated or they're just not aware of the vaccine status. So it's just being very, very mindful of that, especially as the weather gets better, there's even more travel and more opportunity for that transmission. And so then we also have our measles webpage for the Norwalk Health Department. Just want to emphasize this. And again, we even offer the MMR vaccine. So one can follow up and call us. And so the information is all here on this webpage, as you guys are familiar with, but just wanted to reemphasize that point. And then with that said, I just want to kind of just jump over really quickly just to be aware of, we have the vector-borne situation. Mosquitoes are going to show up more so a little bit later, but they are still happening right now, in terms of mosquitoes that can transmit other infectious diseases. But, they really kind of peak during the much warmer months. But ticks are still really, grabbing on more or less onto candidates for them to, or victims, if you want to kind of qualify it. And so we want to just be mindful of that data. So this is 2024 data from the Connecticut Agricultural Experiment Station. I zoom in here on Norwalk, and the reason why this document is zoomed out, just so we can kind of have that comparison, because unfortunately Norwalk's much lower on this document here. But to that point, for Norwalk, we had over about 146 specimens that were identified, 87% tested, 87 tested. And then, along with that, about 15% of those specimens tested positive for Borrelia. And so again, that's being mindful of, just kind of Lyme disease, and then other kind of emerging infections relative to anaplasma at 6%, 9% Babesia. Then Borrelia miyamotoi, in terms of, 0% fortunately for that, and Powassan virus. But, there still is a mix of that in our area. This is not a full spread scan. This is just specimens that have come into the agricultural experiment station that they then further tested, because they have to be in a condition that can be tested. If they're destroyed and things of that nature, it's much harder for them to work with that specimen. But to that point, for Norwalk, we do actually have specimens testing positive for some of these emerging diseases, but also especially Lyme disease. So it's important just so we can mitigate that transmission to humans and to your pets and other animals, just again, inspecting oneself, taking the proper precautions, using a DEET appropriate or other kind of insect repellent, or tick repellent. And so this is all listed here on the Norwalk Health Department webpage. And so I just want to kind of just emphasize that point, how important this is. And again, individuals, if you do find that you are bitten by a tick and, it's on your body or on your pet, how to best remove that to ensure that you're getting the full specimen and keeping it as intact as possible, so it can then further be tested to determine what is the, if it's carrying anything, and any risk of that transmission too. And so you also can follow up with the health department and to learn about that process. What else is there to do in terms of that, especially for non-residents, there is a cost too. And so, yeah, just all this information is here at our webpage. We'll find a way to get that link out there, because I know I can't quite do that with the chat in these kind of panel setups in Zoom. But regardless, just to emphasize those 2 different points, or 3 different points relative to respiratory illnesses, again, the prevention that we're all very familiar with. Then there's also just the prevention we can do for measles and getting the vaccine. And then, just making sure you check your immune status relative to that. And then also being mindful of ticks, checking oneself and your pets, and family members and friends too. Just to catch this early so you don't get bitten, but if bitten, obviously doing the appropriate protocol relative to that and keeping the specimen intact. And also not leaving any part of the tick in your body where it can further release any infectious disease. And so it's just really important. And then also getting that specimen tested. So all that information is in these respective web pages and infographics. So just want to summarize relative to that, and just be mindful again with this better weather, what else we're contending with too, even with respiratory illness season kind of, weighing downwards. But there are, again, other respiratory viruses circulating. All right. Well, thanks everybody. That's it for today. All right. Bye.
Thank you, Brian, for your great presentation. I think Anthony has a question.
Just a
or
quick comment. I'm looking at the tick website, the tick section of the website that Brian just showed. It refers to summer 2022. So if that's still, if the WestCon study is still going, you may want to update that. This is if you submit or have submitted a tick during summer 2022.
Thanks, Anthony. We'll look into it. Does anybody else have any comments or questions? All right, hearing none, I'll move on to the next item, which is budget updates. So I have a PowerPoint that I want to pull up. All right, I'm going to share. Can you guys see does the screen look okay?
Yes.
Okay. And can you see if I advance to the next slide?
Yep.
All right, thank you. Okay, so I wanted to give an update on sort of where we are, just an overview of I know we've spoken throughout the budget season about the operating budget, but I wanted to give some, a quick update presentation about that, and then also talk about the capital budget, and then have a discussion on, what's going on with the grants right now. So just as a reminder, we're part of the Community Services Department. So when looking at the operating budget, we work really closely with Lamont Daniels, our Chief of Community Services, and we work with the other departments as well that are part of the Community Services Department. So it's Health, Human Services, and the Public Library. And so we all have this, shared mission of increasing and sustain the social well-being and health of all Norwalk residents. And, we work really closely and partner with these departments on different initiatives. And you know all about what the health department offers, but the Human Services Department focuses on enhancing residents' quality of life through services such as early childhood programs, fair rent assistance, community resource hub, ADA support, elderly services, and youth services. And they've been an amazing addition to the city under Lamont Daniels and Ana Vivian Estrella's leadership. She's the Director of Human Services. And as you know, that department has certain division departments that had existed before, and then there were additions added to it. And as you know, the public library is really a cornerstone of community engagement. It offers it's not only books that the library offers, but it's educational resources, technology, cultural programs, really focus on lifelong learning, computer access, library initiative, literacy initiatives, cultural events. So when I'm going to be focusing just on the health department, like line items in the operating budget, but as the city as a whole, when they're looking at the budget, they're looking at and they summarize it also based on, we're part of the Community Services Department. So when we worked on the budget, the operating budget request this year, there were a lot of considerations, a lot of context to the budget. We have our state and local mandates. As you know, the health department by law is required to offer services that are spelled out not only in state law, but local law. We have community need. We have our community health assessment. We have lots of different data points and qualitative information, and just, hearing from our residents, our patients, the people that we serve about the needs in the community and how those fluctuate over time. We've seen level funding or reduced funding in many different grants over the years. And this is sort of something that happens in public health where something will occur. There'll be money that is specific to addressing that health issue, that categorical funding for a specific reason. And over time, it could be, you could see level funding or reduced funding in certain areas. One example is in preparedness. After 9/11, there was a lot of focus on preparing. And over time, that money has decreased. We've seen with WIC, we have our obligations under union contract for our employees to get raises, to get, increases over time, but often we've seen level funding in WIC, so trying to balance all of that out. And the taxpayer, right? We know we're in a difficult budget season, and that's always something that is in our mind, and obviously in the administration's mind, the council's mind, Board of Estimate Taxation, all of your minds as well. So I don't know, this is kind of small, but I wanted to summarize sort of, we have these different, they used to be like divisional areas, and over time we've grown, so it doesn't match up exactly. But so under health admin, we have, administrative support to the department, staff that are in the office of the director. We have our epidemiologist in the admin division. So there's a lot of staffing that's included within the administration division of the budget. Building maintenance, that budget is overseen by building management. They're a different department in City Hall that oversees the different buildings across the city. We have environmental health and housing. We have a sealer of weights and measures. We have our community health division. We have a lab that used to have, full-time staffing in it, but over time we've, transitioned those services to the state and outside labs. And then we also have our preventable diseases division. So I wanted to show, what was in our 2025 budget, what did we request, and what was recommended. I wanted to also point out that these figures also account for revenue. So certain divisions like environmental health and housing and preventable diseases also pull in revenue. So that reduces the overall, expenditures and the budget. It reduces, it lowers the cost, for those different divisions. So that's also, this is revenue and expenditures combined. And because that's how the city looks at it when they look at the overall, percentage increases. In terms of where we put in requests for increases, 42% of those requested increases were because of the anticipated contractual obligations with wage increases, longevity payments. So those were sort of costs that we have no control over. It's part of the union contracts. But then about 55% of the requested increases were related to us asking for an additional 2 full-time staff members and also additional part-time hours, moving to the city's operating budget to meet the different mandates the community needs and to enhance and maintain services. The remaining requested increases were small, like, about 3%. They were related to operational expenses as well as, I mentioned WIC. The city has been very supportive of keeping the WIC program in Norwalk. And so because of level funding over the years and increased costs related to medical benefits, the city has been able to contribute some money to that budget as well in order for us to keep operating it here out of the health department. So, I mean, the story is basically the increases are related, requested increases are related to the staffing. We did request that a part-time environmental staff member become full-time due to changes in mandates related to lead and also keeping up with all the other mandates. And we requested a grant-funded public health nurse to be in the city's operating budget. The recommended, you'll see the city and the mayor's office and the CFO have been very supportive of our requests. They've recommended that a public health nurse be moved to the operating budget so we can keep maintaining those important services. They've continued to be supportive of the WIC program. The only piece that wasn't in the recommended budget was having that part-time environmental staff person be full-time, given the difficult budget situation that we're in. And then this just shows the total of sort of like where we, our budget, our requested and our recommended. And when they're looking at percentages increase, they're looking at overall where we fall as a community services department, not just, within the health department. I mentioned the lead laws, and I think I've definitely spoken about them in meetings before, but there's increased mandates not only for the environmental but the clinical side as well. And also the public health nurse, so the messaging that we shared, we've seen increased tuberculosis cases. We've seen, as I mentioned, the lead case management. We've seen over time increased demand for immunization services. And we were able to add that nurse on using some of the COVID funding. But really, we want to be able to maintain all of the services that have been offered because of that nurse. In the capital budget, really our focus over the past several years is about updating, modernizing, and maintaining our infrastructure. So we had the only capital budget request we had this year was related to painting the building. So we've had approved funding to paint the downstairs last year and then upstairs this year. So that's in the recommended capital budget. There was some discussion about, is this the best place for that? Should that be in the operating budget? Because that's more about maintaining building over time. So that might change. They might switch in the future some of those costs to operating and maybe putting it in building management. But we were happy to have that funding approved or recommended. And then the other thing I just wanted to point out in the capital budget, this wasn't in our budget, but we've been part of it, is this online permitting project, which is about making all our, inspections, fees, everything available online, and working within the same system as the other departments that are doing, permitting and licensing and inspections. And so that funding has also been approved in the capital budget, and an RFP is out right now to get a system in place for the city. So we've been part of that project, and it's exciting that it's moving forward. And then I also wanted to go over the grants. So give me one second. So this fiscal year, we've been managing, and let me stop sharing. I don't need, okay. This fiscal year, we've been managing 10 active grant contracts. 7 have been with the state health department. 2 are with other agencies that have contracts with the state health department, but we're the subcontractor of them. So WIC, we contract with Optimus, who holds the main contract with the state health department for our region. We also are a subcontractor with another agency that holds the contract for the public health preparedness work. So most of our funding, whether it's directly from the state health department or through its subcontractor, it's money that passes through the Connecticut Department of Public Health. And one of our grants, our newer grants, is with a private foundation, the Connecticut Health Foundation. Of the 10 grants that we've been managing, 8 are from federal funding. Most of them come from the CDC, and they pass through the state health department, and WIC is I think Department of Agriculture. Recent trends, I mentioned this at the beginning. We previously had a sexual health and tuberculosis grant that ended June 30th of 2024. That's a grant that we had gotten for many years. The state redesigned their funding strategy, so we no longer had that. And that funding had also, some of that had been used to support the public health nurse that was on the grant. We've also seen, additional reduction in grants over time, as I described before, and some flat funding. We've seen grants fluctuate over time and change in the past as needs change, but in March, the federal government abruptly canceled more than $12 billion in federal grants to states across the country. The funding had been allocated and authorized during the COVID-19 pandemic, and had initially been used to support services such as testing, contact tracing, vaccination. The funds had also been used to address other emerging health issues and public health concerns such as Mpox and measles, surveillance of other respiratory viruses, and promotion of vaccine for children and adults. The Connecticut Department of Public Health was notified of that immediate termination of the grants, and it estimated at more than $150 million in the state that had been allocated to Connecticut for enhancing epidemiology and lab capacity, immunization activities, and addressing health disparities. So included in these funding cuts were 2 of our grants that had been given to local health departments in Connecticut, our ELC2 and our supplemental immunization grant. The ELC2 grant focused on enhancing our response and investigation of COVID-19 outbreaks and investigation of other conditions of public health significance, and enhancing our detection, surveillance, and informatics capacities. And the supplemental immunization grant focused on increasing vaccination rates, vaccine access, and vaccine confidence in our community. We received stop work orders due to these cuts at the federal level for the 2 grants. And I mentioned, we know grants have fluctuated over time, but this is the first time that we've ever received, we hadn't had any advance notice about this. And so it really, truly was unprecedented. The city has been very supportive. They gave us additional time to try to work on, transitioning activities, closing out work. But as a result of those grants, we did lose 3 staff members. 2 of them were full-time and 1 of them was part-time. We thank the city, though, for giving us that additional time to be able to navigate through this, and to the mayor especially. these grants had been previously granted no cost extension. So we anticipated that they would end eventually. We knew that they would end in the future. But sending the notices with no warning and ending funding immediately, that really was unprecedented. We haven't heard about any other funding cuts being in jeopardy. The messaging related to those cuts were that they were COVID-19 specific. They weren't needed anymore. That's, from the federal government, I'm paraphrasing. But we've been trying to send the message out, and public health officials across the country have been saying, well, they've been used for a lot of other purposes too. And the big push in public health has always been we need funding for infrastructure. We need funding that we can use over time so that we have the staffing, the resources in place to navigate through any difficult times or any other health concerns. We know health concerns change over time, but we know they occur over time. And so rather than this funding where it's for this and then take it back, for this and take it back, we want to have sustained funding over time to be able to address anything that comes our way and anything that is happening in our communities right now. We're staying up to date about the federal funding and the upcoming budget, for the federal government. We're also following the court case where several states have sued the federal government over this loss of funding. So we're continuing to navigate through all of this, but I wanted to, give you all this update on sort of what we've been addressing over the past month or so. The staff have been amazing, really pulling together. It seems like the news changes at any given moment, and so really navigating through that uncertainty can be challenging. But we thank the staff, we thank the employees for the incredible work. Definitely a loss to our health department, but we thank you and the board for your insight as well, and for pushing us to think about all of these things and plan for them as much as we can. So I know that was a lot, and I kind of went quickly through some of this, but just want to open it up to see if there's any comments or questions related to any of that. I do want to say that, and I mentioned this in the last meeting, Norwalk has been extremely supportive of public health services here. And so while this is obviously very difficult for us, it has made it easier because they've really invested in the infrastructure and putting staffing in place and resources in place and having the leadership that's, very supportive of public health. So we're just really lucky to be in Norwalk and to have the leadership that we have. And that includes all of you. So thank you.
When will you know if those two positions are funded?
So it's still in the budget as of now. The final budget, I believe, is the first week of May, when we'll know for sure. But so as of right now, one of the positions is in the budget, is in the recommended budget. All right, well, we have a happier presentation next on the agenda. So I'll jump to that if there aren't any other questions. All right. Let me just double check my agenda just to make sure. Yes, National Public Health Week. All right, I am going to share my screen again. All right, I want to, slides look okay?
Yes, they do.
I want to thank Catalina Mosquera, who's our public health program assistant, for putting these slides together for us, and for all the staff who helped take pictures from National Public Health Week. So we celebrated National Public Health Week, which was April 7th to the 13th. This is a picture of our staff when we had a staff training and meeting at the aquarium, and that's also our building. National Public Health Week this year was the 30th year of celebrating it. It's an initiative of the American Public Health Association. Each year, health departments celebrate it to recognize the contributions of public health and to highlight the issues that are important to improving local community health. And this year, I really want to thank the community health team, Kelly Tomlinson and Teresa Argandesi and others for helping us organize an event and working with the mayor's office to celebrate. So we, you know, we asked the mayor if he'd be willing to have a proclamation to join the staff to recognize them. And we invited the Board of Health there as well to celebrate and recognize the work and talk about the importance of public health. So we did that. We also surprised him with an award. So that was really wonderful. We honored him with the Public Health Champion Award for all his leadership and support of the health department over the years. We also had a social media communications campaign during the week to highlight, and we utilized messaging from the American Public Health Association. And we also highlighted the event that we had where we had Mayor Rilling speak. We had Ken Lalim and Frank Ehrlich, two of our board members. Thank you so much for speaking. And we also had Lamont Daniels, our Chief of Community Services, speak. So here are some pictures from the event. And so during the event, the mayor spoke about public health, the importance of the work of public health, and really gave a lot of kudos to the health department staff for all they've done, and also to the Board of Health too for their leadership. I spoke a little bit about, you know, what the health department does and some things people might not realize about the breadth of programs and services. We spoke about, you know, the staff and how amazing they are. Frank gave a really great speech where he talked about, you know, how he's newer to Norwalk and how he came here during the middle of the pandemic. Was unsure, not knowing much about public health in Norwalk, specifically what the services would be like, but how he quickly learned how everything was taken care of under Mayor Rilling's leadership, the Board of Health leadership, and the health department. So it was really nice. And Ken also spoke and gave a great talk about sort of more about the history of the health department and all the great initiatives that the Board of Health has led over the years and the different partnerships in place and how that really makes all this work possible. So thank you to the two of them for speaking on behalf of the Board of Health. And then the mayor read his proclamation, and then Lamont came up and spoke, and then he started talking about the mayor. So that's where the surprises started. Really just his support over the years for the staffing. And I also spoke about how he's been an amazing leader, an amazing person, how, you know, he has such a passion for serving the residents of the city, and he has very much a customer service focus. All of his initiatives to support public health, you know, in the broad sense, you know, and his investments in support of parks and recreation, education, community safety, sidewalks, bike paths, community resiliency, water quality. Him and his wife, the First Lady, leading important health initiatives such as, you know, the Norwalker program and leading walks within the city. He's always been an immunization champion for us. During the pandemic, he was an incredible leader, the best incident commander you could ask for. Think about his investments in public health. And so he really is a true public health champion. So it was wonderful to be able to recognize and honor him. And then Kelly and Catalina put together a great board of different pictures of the health department staff, board members. And then we also found some older things in our library of different news articles, minutes from old board meetings. It was really, really fun to kind of look back at the past and how some things just don't change, you know, even like over 100 years ago. Still tackling the same things. Here's a picture of the proclamation, our staff, our board members. So thank you to that. Again, to Ken and Frank for their support. And we hope to have more and more of these type of events in the future. And that's that. Is there anything they wanted to share? Oh, Frank, you joined. I'm sorry, I didn't realize when you joined, but hello.
Hello.
Any comments that the staff want to add? Anything, board members? All right, well, thank you to everyone for that great event. All right. Next on the agenda is just the director's report. And so I gave most of my updates during the meeting with National Public Health Week and the budget updates, but I did also want to mention we also recognized STI Awareness Week, and we had some additional hours in our sexual health clinic. So thank you to the staff for organizing those. And we definitely saw an increase of patients during that time. We've seen it actually recently for a sexual health clinic. So thank you to the team for mobilizing and offering those additional services to the community. And I think that's it on my end. Does anybody else have anything else before we wrap up today? All right. Hearing none.
Good work.
Thanks, David. All right, we will motion to adjourn at 8:47.
So moved.
Thanks. All right, all those in favor, say aye.
Hi.
Take care.
All right, have a great day,
All right, take care,
everybody.
bye.
Thank you.
You too. Bye.
Hi.